Good evening, everyone. Thank you so much for joining our booth. So my name is Rana Al Ashkar. I'm an OBGYN resident, and I will be today talking with you about baby steps, a journey to a smoking-free pregnancy. So our outline will be, first of all, we will talk about smoking in pregnancy in general. Then we will just dive deeper into why we should stop smoking and ways to quit and what you should do. So a step-by-step plan to quit smoking during pregnancy. So smoking in pregnancy in general, these are numbers that don't mean anything to you currently, but just for you to know that 54% of women usually quit smoking when they first know that they're going to be pregnant or when they are planning to get pregnant. But 20% of these women will slip on smoking and get back to smoking while they're pregnant. And 60%, which is a huge number of ladies, will go back to smoking once they gave birth. So we know that smoking has very bad effects on pregnancy, and this is just to tell you or to remind you basically that nicotine and carbon monoxide are both very, very dangerous and toxins that are present in tobacco smoking, and usually they are used in cigarettes and in other types of smoking tools that we will speak about later on. And they have very bad negative effects on pregnancy outcomes for the mom and for the baby. So just to list a few, and just to highlight something very important, that smoking doesn't only affect the baby in the mother's belly, it might affect also the placenta, which is the source of nutrition for the baby. And it might also affect the course of the pregnancy. So it might cause what we call an ectopic pregnancy, which is a pregnancy outside of the uterus. It might also cause problems in the thyroid function in the female and multiple effects on the baby, mainly a growth restriction. So the baby will be born smaller in size than what he should be or she should be. And these risks will go beyond the pregnancy. So babies who are born to mothers that smoke usually have higher rates of respiratory tract problems. They might have asthma, they might have a problem in their digestion, so infantile colic, bone fractures more, and childhood obesity more. So smoking doesn't affect only the baby when he is in the belly, but it might go beyond that. And this is also problematic. And not only smoking affects babies or pregnancies, also secondhand smoking, so being exposed to someone who is smoking beside you, will cause 20% an increase in the low birth weight in infants. So the effect of smoking, whether you smoke or whether you are just smelling the smoke and absorbing the smoke, will be bad on the pregnancy. And what we should also highlight is that vaping and hookah or hubble bubble smoking is also smoking. So you should really take good care of this because multiple people have the misconception of or an incorrect perception that vaping represents a safer tool or a safer alternative for cigarette smoking. This is not correct, unfortunately, because vaping use multiple colorant and multiple odorants that are very, very harmful to the pregnancy. And hookah smoking also, or water pipe, also exposes you to nicotine, which is a very harmful neurotoxin that we already spoke about. And there is a charcoal brisket combustion, which produces double the amount of CO and double the trouble in pregnancy. So how we should say no to CO, how we should stop this right now. Basically, what you should always know is that smoking cessation in pregnancy at any point in pregnancy will be helpful for you and for your baby. And mainly, it is very helpful if you stop smoking before 15 weeks of gestation, so in the first trimester of your pregnancy. And the first step always starts by you. So you should decide that you want to quit. You should always discuss this with your OBGYN. And usually your doctor and the maternity staff wards are very trained on this matter, and they can also provide you with adequate steps in counseling regarding stopping smoking and how to go through the process. And studies have shown that increased counseling by your physician and by the staff maternity staff ward, will be helpful and will cause a positive effect on you in stopping smoking during pregnancy. So it will help you more. So discuss this with your doctor. So basically what you should wait for, what we should expect, first, that there's a lot of barrier for quitting smoking. Multiple of them is the Partner. So basically, when you live with someone that smokes, study showed that it is harder for you to stop smoking and you will relapse multiple times. And when the partner is very active and is very helpful in the process or in the cessation process, you will find it easier to stop smoking. When you stop smoking, you should also understand that you might experience nicotine withdrawal symptoms, and they might vary. So they might include nicotine cravings, anger, frustration, irritability, difficulty in concentrating, insomnia, so inability to sleep, restlessness, anxiety, depression, hunger, and increased appetite. And these are all very debilitating and very bad effects that you should expect, and we will speak about how to deal with these symptoms. So what should you do? I know it's hard. We all know that it's hard, but it always starts by you deciding not to smoke. So for the nicotine withdrawal symptoms that we spoke about, first know that nicotine withdrawal symptoms will subside over time. So they will be very bad in the first week, usually in the first 3 days after smoking, but they will decrease in intensity and you will find yourself better. Of course, everyone is different, and some people might experience withdrawal symptoms later on after quitting. But what you should do for the nicotine craving? So always remind yourself that this craving will pass, and you should avoid situations that might trigger you to use tobacco. So for example, it might be sitting with your friends that are all smoking, it might be seeing your partner smoke, it might be drinking a cup of coffee. So you should just avoid this situation until the nicotine craving subsides. Also, as a substitute for smoking, you can always try to remind yourself that it's part physical and it's part psychological. So if you keep your mouth busy by chewing sugarless gums, by eating hard candies, or by just breathing in, breathing out, this will help you in decreasing the nicotine cravings. And this is one of the PEP exercises that we speak about. So it's just to take a deep breath throughout your nose and blowing it slowly throughout your mouth. And you can repeat this 10 times just to decrease your craving by the psychological effect of it. Next, you should find a social support. So basically, when we decide to quit smoking, we should communicate our decision to all our support system because these people will help you throughout your symptoms. You should create a positive smoking-free environment. So for example, if you decide to quit smoking and you're currently pregnant or you're expecting a baby soon or you have a small baby in your house, it's very helpful for the baby and for you to just tell all the people not to smoke inside your area. So this will be your smoking-free environment, which will decrease your cravings and decrease your symptoms, and it will be helpful for the baby or for your fetus. Ask for help if in case nicotine withdrawal symptoms kicked in. So usually you could ask for help from your support system or from the physician, and you should develop coping mechanisms. So these coping mechanisms can vary a lot, and there are multiple tips and tricks for this. For example, you can just avoid triggers. You can try to replace nicotine craving with something else. So for example, when I crave nicotine, I want to eat a carrot, for example. So just try to find coping mechanisms for yourselves. Nicotine replacement products. So as you all know, when we want to stop smoking generally outside of pregnancy, there are multiple replacement products that usually physician will tell you about. So for example, there are the nicotine patch, the nicotine gum, etc. We know that nicotine is harmful during pregnancy, so these replacement therapies should be considered only after a detailed discussion with your physician, and it should be solely for quitting smoking. So if you're not deciding to quit smoking and you just want to decrease your nicotine uptake, nicotine replacement products are not really recommended. For the pharmacotherapy or the medication that might help you to decrease in your smoking or to quit smoking, unfortunately, both medications that are prescribed are not really found safe during pregnancy, and they are not recommended during pregnancy. But you can use these products later on in your postpartum period after a discussion with your physician according to your breastfeeding status. If you want to breastfeed or no, how long do you want to breastfeed, etc. So you can start them after you stop breastfeeding or after in your postpartum period under a specific guidance from your physician. And just to end this with that your craving is temporary. I know it's hard, but know that the damage to your body and your baby will be permanent. Thank you.